in the clinic today. Am I speaking to Mr. John, a 45-year-old?
No, you're talking to his brother,
Brother
Mr.
of
Wilson,
Mr.
doctor.
Sorry. Yeah, I'm
Yes,
talking
doctor.
to. Am I talking to the brother of Mr. John, Mr. Wilson?
I am doctor.
Yeah. So, Mr. Wilson, today we are having this meeting to discuss about the health condition of your brother, and I will be examining him. Is that okay?
Yes, doctor. That's all right.
Okay. Okay. So, Mr. Wilson, tell me about his health condition.
Yes, doctor. Actually, my brother has been experiencing some swellings in his neck, doctor, for past 4 months, and
Mm-hmm.
he noticed it incidentally 4 months back, and since then they are there, and they are present on the both sides of the neck, doctor.
Okay. Is this the first time in life he has noticed these kind of swellings, or he had these kind of swellings before also, before these 4 months?
For the first time, doctor.
Okay. So, since the time he noticed the swellings, the number of the swellings and the size of the swellings is increasing.
We don't know, doctor. We didn't check the number of swellings. You can check it yourself. We don't know they are same or different. We don't know about it.
Okay, I would just like to have a look at the patient's neck, and can you tell me it's on the both sides of the neck and exactly which side? And
Both
I'll
sides of
just
the
have
neck.
a look. I'll just have a look also at the patient's neck, visibly if there is any swelling.
Okay.
Okay, and
No, there is no swelling in your patient.
okay. Any these swellings, they have any pain? He's having any pain around these
No,
swellings? Any discharge from it,
no,
like any yellow color or red color discharge? Okay. Any redness around the swellings?
no, doctor. No redness.
Mm-hmm. Any difficulty of breathing because of the increased swelling,
No, doctor.
or difficulty in sleeping? He recently started snoring at night. You have any idea?
No, doctor.
Okay.
No, doctor.
Okay. So there is no abnormal breathing sound comes, right? And these
Sorry, can you please
swelling,
repeat?
there is no abnormal breathing sounds like his when he breathe. You are able to, there is no abnormal
No,
sounds
doctor.
while breathing. Okay.
No,
So this swelling. Um, uh, Tell me that your brother is having any swelling on any other part of the body other than neck also.
I don't know. We didn't check.
Okay. He's having any joint pains or back pain?
No,
Any pallor? You feel that he is paler than before, or any kind of
no,
skin changes? He is having
no.
any lumps or bumps in the body
The only lamps we already told you about the
other
lumps in the
than
neck,
this?
doctor.
Okay. He's having any weight changes recently?
Yes, in these 4 months, he has lost 2 kg weight.
Okay. Uh, it was intentional or unintentional?
Unintentional, doctor.
Means any change in appetite?
Appetite is fine.
Okay. Any weather preferences?
No,
Is having any fever? High body temperature?
he didn't told me this thing, doctor.
Okay. But right now I can see from the chart that he's having very mild fever. Okay. So any itching or rash on any part of the body?
No,
Okay. And also any recent hospitalization?
no,
Any recent flu or fever like illness?
no,
Any recent change in medicine or in starting of new medicine?
no, no. He's not on any medicines.
He's having any night sweats?
No,
No. Okay. Any his sleep is also fine, right? You told me.
Yes.
Okay. Now, just tell me that have has he ever diagnosed with any long-term illness in the past?
No.
Okay. Any significant family history you have, like of
Hmm. Yes, my
no?
father had some sort of blood cancer.
Okay. Other than this, anything else? That's it.
No, that's all I know, doctor.
Okay. Okay. And any past surgical history with Mr. John?
No, doctor, no surgeries in the past.
Okay. Any headache he has?
No, he didn't mention
Blurry?
any headache.
Any changes in the vision? Any seeing problem?
No,
Vision problem? No. Any weakness? Any part of the body?
no,
Any numbness in any part of the body?
no.
Any cough recently?
Uh, on and off, a little mild cough is there. Yes, he's coughing
Dry
as well.
cough? Dry cough.
Yes, dry cough.
Okay. Okay. Any chest pain along with the cough?
No,
Any racing or pacing of the heart?
no,
Any tummy pain?
no, doctor, no tummy pain.
And tummy distension?
No.
How's his bowel works?
They are fine.
How's water works?
He never mentioned any problem to me, doctor.
Okay. Any stiffness or in the neck?
No.
Okay. So I would like to ask some personal questions. Okay, we ask everybody, and we well keep it confidential. Does he smoke?
Yes.
Does he? Okay, how many cigarettes a day? For how long?
Almost a half pack daily, and it's been 20 years.
Okay, I would advise him to stop smoking. And okay, when I meet him, and I will offer him the smoking session services. How about alcohol?
No, he's not drinking.
Okay, any illicit drugs or any party drugs he might be using?
No, doctor.
Any tattooing, needling, piercings?
No.
Does he have a one stable partner or casual partners also?
He's married, doctor.
He's married. Okay. Um, he's okay. And does he drive?
No, he's not driving, doctor.
What does he do for the live for his living?
He is a farmer by profession, doctor.
He's a farmer. Okay. And any recent change in profession? No.
No.
Any recent travel history?
Sorry, which history?
Any travel history?
Yes, 1 year back he traveled to Africa.
Okay. 1 year back. Any
Yes.
contact with sick persons there?
I don't know. I was not there with him.
Any, you know that he was vaccinated before going there? Any history of insect bite there, or when he come back he got sick or something?
I'm not sure about these things.
Okay, no problem. How are the swellings that have affected his life?
He feels tired these days, doctor. Like he feels tired. Like when he try to do any work, he feels tired. Uh,
Okay,
that is his. This is how these these swellings are affecting his life.
okay, okay. And he's not able to do his work, right? Because he's a farmer, he needs to do a lot of physical work, right? I would like to
He
offer the
can do, doctor, but his exercise, his work capacity or exercise tolerance has is become
reduced.
limited now.
Okay, okay. Okay, Mr. Wilson, I would like to offer your brother the support from the occupational therapist. Okay, I would like to examine him now. Okay, starting from the general physical examination of the patient with the hands. Okay, any clubbing, at the hand, leukonychia, chylonychia, palmar erythema, any abnormality, any tremors, and then I'll just do check the pulse of both hands, okay, and both sides, and blood pressure also, and then I will check the proximal myopathy in the upper limbs, and then I'll check his eyes, mouth for pallor, any yellowness in the eyes. Recently, his eyes were any yellowness you noticed or something?
No idea, doctor.
No,
You can
okay.
check it yourself.
Yellowness in the eyes, pallor, and mouth for any ulcers. I would like to, after uncovering the patient's neck and I'd like to palpate the swellings. Okay, I would like to go at the back of the patient initially. Is his thyroid palpable? Initially, I would ask him to just take a sip of water, hold in your mouth, and when I say swallow, then you can't swallow it. Okay,
So
I'm just.
when you are examining your patient, there are no neck swellings.
Hmm. There are no neck swellings at all.
No,
In the thyroid is not palpable, right?
not even the
Okay.
thyroid.
Oh, okay, okay. After thyroid, I'll just check the submental, submandibular, cervical lymph nodes,
Hmm.
and these post-auricular, pre-auricular lymph nodes,
Hmm.
and posterior cervical lymph
Hmm.
nodes, and axillary lymph nodes, and so
Hmm.
can you point out where were the swellings you were talking about?
There are no lymph
There is.
nodes in this patient.
Okay, no lymph nodes and no thyroid, right? Okay.
No,
Axillary lymph nodes, no? Okay.
no.
I would like to check the fever of the patient. Is he febrile now at the moment?
The temperature is same as given to you.
Okay. And then I would like to auscultate the chest. Um, um,
Okay.
uh, Auscultate the chest, all the zones. Is there any wheeze or crackles, anything I can?
Okay. Chest is normal.
Normal. Precordium and
You have
tummy.
got two
I would.
minutes remaining with your patient.
Okay, I'll just like to palpate the tummy. And
Okay.
any findings up till now?
There is nothing in the abdomen as well.
Okay, okay, Mr. Wilson, can you tell me what are your concerns?
Yes, my first concern is, doctor, why is he having these neck swellings?
Hmm. Okay, Mr. Wilson, by during my examination, I could not find any neck swellings,
Hmm.
and um, he might have had some neck swellings before, and because we can easily get these kind of neck swellings due to some infections that later when the patient is in the recovery phase, they go away also, they fade away also. So what can we do?
Hmm.
I will do some imaging or some jelly scan of the neck, okay, to see if the swellings are
Hmm.
still there or no. And what are
Hmm.
your other concerns?
Yes, my second question is, doctor, uh, do you think is he having the same blood cancer as my father?
Mr. Wilson, your brother is really young, okay? And if the family history is positive, especially like your father, first degree relative, there is still a possibility. But given, that given the thing that he has lost weight, fever, and cough and all of that, it can be some infection also, or it can be some other cancer possibility also, or it can be some benign growth only in the glands of the neck. So for confirm that, I will do some blood test, which and also some imaging, and then I can confirm it, and according to that
All
we
right.
will treat your brother.
Thank you, doctor.
Hmm.
All right.
For why?
So
Hmm.
tell me your differential diagnosis.
Okay, I'll just need one moment. Okay. Um, I don't need to present the case, right? Only
No,
differentials.
just tell me your
Okay.
differentials.
Okay. So my first differential diagnosis is um, it can be some infection
What
Especially chest infection,
sort of chest infection? Be specific, please.
some atypical pneumonia.
You think atypical pneumonia will stay for 4 months?
No, it will not stay for 4 months. It will stay. It can stay only up till 2 to 3 weeks. So it can be some tuberculosis.
Okay, fine. Tuberculosis. What else?
Um, Tuberculosis, and it can be some brucellosis. Patient is a farmer. Some abscess
Okay.
of the
Anything else? Any other possibility?
some liver abscess, or some abscess in some patient has weight loss, also heavy smoker,
Hmm. So what else it could be?
mild fever. It can be some lung malignancy other than infection. It can be malignancy also. Lung malignancy, and it can be the blood malignancy also, because it can be some lymphoproliferative or myeloproliferative disorder also, because patient
Hmm.
is having strong family
Any
history.
other any other cause of dry cough with lymphadenopathy in the neck?
Sarcoidosis.
Yes,
It can be
sarcoidosis as well.
sarcoidosis
It's a
also.
very
Yeah.
good differential. Yes, it's a good
Mhm.
differential. Fine.
Mhm.
Okay. So
So,
how would you like to investigate this patient?
I would like to investigate this patient in starting from the general investigations, including CBC, ESR, CRP, LFT, RFT, electrolytes, and specific investigations to rule out sarcoidosis. I would like to do the chest X-ray, serum calcium levels, and serum ACE levels, and I would like to do the um, um, if X-ray is unequivocal, then we can go for the CT chest, and also, especially if there is any swelling we can find on the ultrasound scan of the neck, we can take the biopsy. We can do the FNSE, and
Hmm.
we can take that tissue biopsy to study that tissue. Okay, and other than that, blood cultures we can do to rule out any possibility of any infection,
Hmm.
and urine
Okay.
cultures and urine dip.
For TB, what you will do?
Tuberculosis, a chest X-ray and CT we have already done, but we can do the sputum. Sputum examination is very important.
So if your patient is having dry cough, what you will do for him? No sputum.
Yeah, if the patient is having dry cough, we can do the saline nebulization. If still it's not dry cough, if not, then we do the IGRA test, I think.
Anything else you will do for tuberculosis?
Same, the study of the lymph nodes. If we find any lymph nodes, we study that under microscope. It will show up, or maybe some interferon
Hmm.
gamma release assay test.
Any other test you know for tuberculosis?
This skin test.
No. We can go for
No.
bronchoscopy.
Bronchoscopy with bronchoalveolar lavage.
So
Yes.
how do you think bronchoscopy is going to help us in this patient?
Bronchoscopy, it can tell us the exact site of the lesions, and we can take the lavage, bronchoalveolar lavage. We can study that. We
So
can
how
do the
lavage
exact
is going to help you in this patient?
lavage. Will not only microscopy, we can culture that lavage for the
Okay, but how
tuberculosis.
lavage is going to help you in this patient, particularly in this patient where you are thinking about sarcoid as well?
Hmm. Yeah. Okay.
Okay, all
It
right.
will tell us the stages of the sarcoidosis. Stage.
No,
Which
stages of
stage? Or
sarcoidosis, we require HRCT, we don't require
oh,
bronchial viral lavage. Okay, yes,
okay. Mhm.
lymphocyte count is going to help us, and CD4 count. Okay,
Yes.
as well, CD4 to CD8 ratio we usually calculate as well, and lymphocyte count, predominant lymphocytic lavage can be seen as well. So that is going to help us that to differentiate it is sarcoid or this is TB. Okay.
Mm-hmm.
So, coming on to this case, there are few learning points. First of all, I will discuss them and then we'll move to this case. There was overall, your approach was good. The approach to lymphadenopathy was good. The way you took the history in the start, the local questions, then you asked the pertinent general questions from the patient, like the fever, fatigue, weight loss. They were good questions, and then you jumped to the questions of the system, so that was good. But few questions they were missed that I will discuss. But overall, the approach was okay. Like you can get little bit satisfactory by one examiner and maybe borderline by the other examiner. Coming on to the examination, you didn't check the inguinal lymph nodes. I think you didn't mention about the inguinal lymph nodes. That's very important in this patient. Mention about inguinal lymphadenopathy as well while you are examining this patient. Rest, the examination steps were fine. You can get satisfactory for that. The learning point that I want you to remember is even from the outside, it is written the patient has neck swellings. But if you don't find any neck swellings in your patient, please don't make it.
Okay.
So this is not the rule that if they have written from the outside, the patient has neck swelling. This does not mean that patient will be having neck swellings inside as well. Please remember this. That was the case in Karachi center. This was the case in Islamabad center last year as well. Outside it was written neck swellings. Inside patient was absolutely normal. No finding.
Okay.
So this is the learning point. For example, there is a very famous center, Southampton, and some other centers in UK. Outside, they write patient is a known case of aortic stenosis and now patient has presented with falls. Now, from the outside, you have learned that there is going to be a murmur in the patient. But do not make a murmur if it is not there in the patient. The patient is going to be absolutely normal. In one of the center in UK, there was a case of patient is a known case of Graves' disease, and patient was started on carbimazole and now presented with fever. That was the long clinical consultation, and patient was absolutely normal. No findings of Graves' disease in that patient. What does this mean? You have to trust your patient rather than trusting a scenario from the outside while you are looking for clinical signs in long clinical consultation. Please make this point very, very clear in your mind that you will say a sign only if it is present. Even if they have written from the outside, this does not mean the patient will have that sign inside as well. For example, one of the very famous center of UK, Central Middlesex Hospital. One of the famous scenario there they give is bradycardia, bradycardia related tiredness. That's a very typical case there. Outside, they will write the pulse of the patient 40, 42, 48 maybe. Inside, patient will be absolutely normal. This does not mean you will say 48, 42. You will say the signs in that patient basically who is present there and to whom you are examining basically. Not any random signs from the outside. That's the first learning point from this. The second learning point is that your exam PACES is an exam of differential diagnosis. And remember, I used to say this thing multiple times that every positive thing in a history is a differential diagnosis. Every positive thing in your history is going to be a differential diagnosis. Now he has some dry cough with cervical lymphadenopathy. So tell me differentials for this, please, Dr. Zakia.
Sarcoidosis, tuberculosis,
Tuberculosis, tuberculosis.
brucellosis,
Have a positive family history of blood cancer will give you
legalia.
another differential diagnosis, a lymphoma.
Hmm.
Having a
Hmm.
positive travel history to Africa should give you another differential diagnosis. Maybe tuberculosis, like that, again for tuberculosis could be a possible.
Hmm. Hmm.
So remember this thing that every positive thing in PACES exam should lead you to a differential diagnosis. Most of the time, most of the time. And the third learning point is when most of the history is in negatives, everything is going towards negative, 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 negative. Your diagnosis lies in the personal history or in the past medical history. Like in this case, the personal history, like the travel history, the occupation, the smoking part was actually the leading part. So don't get confused or don't get, puzzled by this thing that I am unable to reach a diagnosis. No, Maybe the diagnosis lies in the personal history. Maybe the diagnosis lies in the family history. Maybe the diagnosis lies in his medications. This is the other learning point from this scenario. Now,
Okay.
if we come to the concern dealing, uh, please don't use the term benign. For benign, you can use the term harmless or non-cancerous growth. You can use the term either harmless or
Okay.
non-cancerous growth. So when
Mhm.
usually the first concern in every scenario is going to be, doctor, what's wrong with me? So in that case, you will explain your differential diagnosis in layman terms. For example, I will tell him that, Mr. Wilson, there could be several reasons of these neck swellings in your brother's case. There could be
Mm.
any infection going
Mm.
on in the glands of the neck, like it could be tuberculosis or some other bug infections going on, or sometimes it could be problems in the defense system, in which our defense system attacks our own body, like joints and lungs and glands as well. This disease is basically called as sarcoidosis. You don't need to get bothered by the medical term. I'm sorry to use this term. So that could also
Mm.
be a possibility. And lastly, this could be any type of blood cancer as well, but I'm not really sure what it actually is right now. I need to investigate your brother further. I will run some blood tests. I will run the scan of the neck. I need to run the other scans, his chest, his neck, his tummy. We'll sit together once the results are available to discuss your brother's management plan as well. What do you think about it? And then, is it a blood cancer? So you will say, in whenever this scenario, this kind of concern comes in the exam, is it a cancer? A very simple answer to that concern would be that, Mr. Wilson, your concern is very genuine, and I can see that you're worried about your brother. Cancer is always a possibility in any case. Cancer can never be ruled out just on history and examination. But it seems less likely in your brother's situation. But still, I would run some investigations to rule it out. A very diplomatic kind of an answer. That cancer
Oh.
is always a possibility in any case. I cannot rule out a cancer by just history and clinical examination. I need to run some tests to confirm the presence or absence of the cancer. However, it seems less likely. Where it seems likely, you will say that it seems likely, or it could be a likely problem in your brother's condition. However, it seems less likely in your brother's situation. Yes, anyone want to ask any questions so far? And then I will move to the approach of lymphadenopathy basically. Yes, this is deceiving, and this is what happens in the real exam. So you need to be very confident in your clinical signs. You should not be making up a sign if it is not there in your patient, even if they have written from the outside that this thing is present in your patient from the outside. So please
I
be
have a
very, very
question.
clear. Yes, please.
So basically, lung cancer is a differential diagnosis here, right?
Yes, it's a good differential diagnosis, definitely.
Okay, but the patient technically doesn't seem to be cachexic and does not have any lung findings. So would that be
Again, the
justified
same
giving
thing.
lung cancer?
You need to give the differentials. As I told you, that patient is going to be absolutely normal in this kind of cases. So you need to give a very broad differentials here. Like it could be any infections in the form of tuberculosis, brucellosis, or maybe other atypical infections like cytomegalovirus or Epstein-Barr virus, for example, in my patient. Then it could be a malignant cause of lymphadenopathy, which could be primary hematological malignancy like lymphomas, lymphoproliferative disorders, or it could be secondary or metastatic lymphadenopathy. And third, I would like to rule out any autoimmune cause of lymphadenopathy in my patient in the form of sarcoidosis in my patient as
But
well. So
uh,
in such
but they won't
situation,
say like it has been like 4 months and the patient doesn't have any lung finding, no cavitatory
no,
presence, no nothing.
no, this does not mean that patient cannot have tuberculosis. How many patients of tuberculosis have positive findings on the examination?
No, I'm not talking about tuberculosis per se. I'm talking about lung cancer. I mean, it's been four
Even
months
even in
and
lung cancer, even if the lung cancer is paramediastinal or it is central in origin, you might not find the findings.
Yes,
The purpose
not
is it's an
necessary.
exam of it's not necessary. It's an exam of differential diagnosis. You need to give them a holistic approach, a generalized approach to the case. Otherwise, they would have given you hemoptysis, weight loss, excessive weight loss, maybe positive clubbing in your patient, but they have not given you because they want to check your approach of lymphadenopathy. They don't want your diagnosis of lymphadenopathy. They want your approach of lymphadenopathy.
got it. Thank you so
They
much.
they are checking your approach basically of that thing. Like most of the time, as I told you, that they are checking your approach. They don't want you to diagnose someone. They want you to give them, some solid differential diagnosis. So this happens in the exam. They want to check your clinical signs as well, that if you are sure about it or not. Like in the exam, those candidates pass the exam, they got full marks in this scenario. Like when this case appeared in Islamabad, who mentioned that said the patient is absolutely normal. But if you say that said, there are some lymph nodes in the patient, they will not give you the marks. So they are checking your clinical sign scale as well. So they have to somehow test you with that clinical sign, and they are checking it by this way. So tell only sign if it is present while examining your patient. So coming on to the approach of lymphadenopathy. First of all, whenever they give you any whenever they give you any neck swellings. So neck swellings could be of two possibilities. Either it is going to be a thyroid swelling. In generally, we're talking about either it's going to be PACES point of view. Either it is going to be a thyroid swelling or it is going to be a lymph node swelling usually. So there you will ask from the patient where they are, site, okay, and how did you first time notice it? Are they increasing or decreasing in the size? Are they increasing or decreasing in the size, for example? Do you have any pain in them? Then you will ask the local questions, the local pressure questions. Do you have any difficulty in swallowing? Have you noticed any changes in your speech? So speech question was missed. Any changes in your speech? Because it may be any laryngeal carcinoma with just simple lymph nodes in the neck. So any changes in your speech? Any problems while eating? Any difficulty in swallowing? Do you snore at night? Have you noticed that recently you started snoring at night? So local compressive symptoms. Do you feel any sounds coming while you take a deep breath or while you are breathing for any stridor or any wheeze in your patient? So that you can ask the local questions. Now, once you're done with this, then you can, in this kind of scenario of lymphadenopathy, you can ask, have you noticed these kind of swellings in any other part of the body as well or not? Next, the important systems that you need to cover with lymphadenopathy, like before going into the details of those systems, first you will ask the general questions like fever, fatigue question is very important. So the questions that I was talking about that you missed, Dr. Zakia, were the questions of hematological system. So what are the questions of hematological system?
Um,
Any
yeah,
bleeding from any part of the
bleed.
body,
Yes, yes,
any
bleeding.
easy bruisability, any bleeding from any part of the body, any bone pains have you noticed? Have you noticed you asked about the pallor, but ask other questions of anemia as well. Do you feel breathlessness on walking briskly? Any racing of your heart? Any awareness of heartbeat if you walk briskly? Have you noticed that you get dizzy on standing up from sitting position? So questions of anemia and questions of thrombocytopenia. Then you can ask the questions of lymphopenia or from the immunosuppressive point of view, you can ask that have you noticed that you're getting more infections recently? Like you are getting frequent infections recently. So
Hmm.
hematological questions are very important and they should be asked with lymphadenopathy.
Oh,
Then this is the first system to cover. First is cover the hematological system. Cover the hematological system. The next important system that you must cover in detail is going to be the respiratory system, because most of the time the underlying disease is coming from the respiratory. So, have you noticed any cough? And then you should ask, have you ever coughed up blood as well? Coughing up blood, any noisy breathing, any noisy chest, coughing up blood, any noisy breathing should be asked from the patient. Then, regarding the sarcoid point of view, you can ask, have you noticed any painful bumps on your shin? Any type of any painful rash or any rash on your no, around the nose or in your mouth in the past, or around your lips in the past. Then, have you noticed any redness, any grittiness, particularly any grittiness in your eyes in the past, or any dryness in your eyes? So, grittiness, redness, dryness in your eyes. Then, joint pains, particularly on and off mechanical joint pains, or joint pains could be features of sarcoid as well. So, you should ask for that as well. So, cover these systems well. First, cover the hematological system by asking the questions of anemia, thrombocytopenia, and lymphopenia or leukopenia. Then go and ask the questions of respiratory system, and then ask the questions related to sarcoid, as I told you, and then detailed questions: tattooing, piercing, needle sharing, blood transfusion. So tattooing, piercing, needle sharing, blood transfusion, 4 questions are mandatory. Then HIV related history, and do you practice? May I know, are you sexually active? Do you have a stable long term partner? Do you practice safe sex? At least these 3 questions should be asked from every patient when you are suspecting the lymphadenopathy in any patient. Now, coming on to the examination of any patient who comes with lymphadenopathy. One of the time in one of the UK center from the London College, there was a case of lymphadenopathy, and the underlying diagnosis was infective endocarditis. Okay. Outside the command was patient presented with neck swelling. Inside the patient was a known case of some valve replacement surgery. I don't remember exactly what valve was replaced. Some valve replacement surgery on warfarin. And only those candidates were able to, secure good marks who asked this question from any recent dental procedures. He said, yes, I recently had a dental procedure. Other than that, he was not having even a single feature of infective endocarditis. But they want your approach that if there is a patient with lymphadenopathy and one of the causes is infection, so why not? Why can't it be infective endocarditis? So you need to give a broader, have a broader approach to lymphadenopathy like this. Now, coming on to the examination, whenever you are given any case of lymphadenopathy, remember a simple formula. Whenever you are given any case of lymphadenopathy, examine all lymph nodes. Like in this case as well, the examiner asks, examine all lymph nodes. When the candidates ask the patient that, ask the examiner, sir, I want to examine the axillary and inguinal, he even said, okay, go and examine. And candidates did examine the inguinal lymph nodes as well of that patient. So you should know that they can ask you to examine any lymph nodes. So you should examine axillary, inguinal, and also the cervical and all this complete cervical chain and all the anterior, posterior, occipital, submental, submandibular, all of them should be examined. So first of all, examine all the lymph nodes in your patient. This is your first task. Examine all lymph nodes. The second system that you need to examine is auscultate the chest. Auscultation of the chest, no need to do a complete chest examination because time is going to be limited. You need to do target examination. So at least auscultation of the chest from the back and the front, and then coming to the in the auscultation, remember by auscultation I mean 2 things. One, you need to check the vocal resonance, and you need to check the auscultation, like the breath sounds. If there are any coarse crackles, then you can check the post-tussive auscultation, but it is important to do the auscultation step completely. Then come to the front, auscultate the heart at least, and then come to the abdomen. But remember, abdomen is more important as compared to heart in lymphadenopathy if the patient has no valvular heart disease in the past. Then first examine the abdomen, and then you can, if you have time, because time is going to be limited, then you can go and examine his heart if you have time. But if you don't have time, just offer the examination of precordium as well. Go to the leg, see for any erythema nodosum, any painful rash, any painful bumps on the, just you can, palpate your hand, just rub your hand on the shin of the patient, please, for any kind of palpable rash, any kind of painful rash on the shin of the patient. And this is how you can finish your examination. So I will repeat the differential diagnosis of this case once again. So differential diagnosis in this case would be, first of all, infections, chronic infections, which could be bacterial in the form of bacterial brucellosis, because patient had a positive travel history, patient had weight loss, patient is having low-grade fever as well. Then brucellosis because patient is a farmer, but unlikely there are no other features like there are no sweats particularly in the patient, so unlikely. Then my second differential here would be maybe a malignant lymphadenopathy, which could be, malignant lymphadenopathy could be in the form of primary or secondary. Primary is basically the of the hematological system, the lymphomas, leukemias, lymphoproliferative disorders, and then it could be secondary in the form of secondaries from the head and neck, or maybe secondaries from the lungs. And thirdly, I would like to keep the differential diagnosis of sarcoidosis as well. So these are going to be the three differential diagnoses here. Yes, anyone having any questions, please? Anyone want to ask anything, please?
Thank you so much, sir. It was a very nice case. Excellent session.
Sir, I have a question.
Mm-hmm. Yes, please.
So it's basically not related to the case, but a general question though.
Mm-hmm.
When we're doing the, post-graduation exams, what we do generally, we take the HOPI, that is the history of presenting illness. And
Mm-hmm.
what we do is that we ask some general questions and then we, start doing the examination. And while we are doing the examination, we usually start from the GTE, we look at the hands, and while looking
Mm-hmm.
at the hands and stuff, we start asking questions. Like, for example, if the case is pertinent, we can do it generally biosections, right? Do you have any joint pains? Like when we come to the arms, do you
Mm-hmm.
have any problem raising your arm from, from the standard position?
Mm-hmm.
When we come to the eyes, ask for, has anybody seen
Mm-hmm.
your pain? Can we
Yes,
do
yes.
this thing as well?
Unfortunately, this thing, examiner really dislike this thing, that you are examining the patient and you are examining the patient, and you are also, doing the history part as well at the same time, because here in the PACES you will not be taking directly history from the patient. There will be a surrogate who will be sitting on a chair. So that's why in such kind of, and also PACES is not about examining everything. It is about targeted examination. Like in this case, you think auscultation of the chest is important, so just auscultate. Like for example, in most of the cases, people do sitting to standing blood pressure, and where it's not relevant, examiner will ask you why it is not required, why are you doing this, and then they will ask you the reason why you want to do it. So you, PACES is actually, it is basically a targeted history and targeted examination. You don't need to ask too much details of history if it is not relevant to the case, and not examining the wholly solely, not head to toe each and everything like we do in our other postgraduate exams. It is not like this. In PACES, it's not like this. You need to be targeted, basically. You need to do
And
target examination.
my second question is, like for example, if I started oscillating the lungs and supposedly I found out findings for sarcoidosis, like maybe pulmonary fibrosis and stuff, and I hadn't asked the pertinent sarcoid questions in my history, can I redo the questions while doing
Yes,
the examination,
definitely.
or when I come
That
back,
you
I
can do.
have
That you can definitely do while you are examining something. For example, you have found something in the chest of the patient, a murmur in the patient. You can ask the questions pertinent to that thing, or something that you have not asked in the history and you think it is important. Then while examining, you can ask, or once you have done your examination, while you are answering the concerns, before answering the concern, you can quickly ask one or two questions regarding that thing. That is allowed. That you can definitely do.
Thank you so much.
Sir,
Yes, please.
Sir, what is the weightage of history and compared to examination in PACES exam? Because I saw the mark sheet. Generally, it is not mentioning anything about the history. They usually, so I'm not aware about this.
No, it's not about the weightage. You need to pass both the skills. The history is judged in your communication skill, and your different, and then your examination is judged in physical examination skill, then the physical science skill. So you are tested in all the 7 skills in your long list. So you are judged in every skill. Like if you, like in this case, if you will miss travel history, straight away they will give you unsatisfactory even your history is absolutely perfect. So that varies from case to case. Like in some cases, sexual history, travel history is not relevant. So even if you miss it, they don't mind. But if you miss something relevant to that case that was very important or to that diagnosis, then they will definitely going to deduct and cut your marks. And then again, when it comes to examination skill, you examined everything, but you forgot to examine his abdomen. Maybe there was some liver and spleen in that patient. So they will not give you any marks in that case in your physical examination skill. Or obviously, if you will miss your physical science, then they will not give you any marks. So it is not about the weightage, like how much they will give you in history and the examination part. So every skill you have to be, uh, you know, you are tested in that case in long clinical consideration.
Yeah. Okay, sir. Thank you.
Yes, everything. History is still even 1 year back. History is still significant because patient may had some tuberculous lesion going on, but recently got some fever, flu-like illness, may had some episode of immunosuppression. Any fever, viral flu, simple viral flu can lead to reactivation or activation of tuberculosis. So that's a very much likely possibility. So travel history even 1 year back is significant. That is why they have given you, particularly from the aspect of tuberculosis point of view. Okay, so thank you everyone for joining. Thank you everyone. See you.
Thank you. Thank you, sir.
Thank you
Thank
so
you.